When you've been three proud, big organisations, creating a story that's true for all of you is a job in and of itself. The role of the transitional CEO, it's about making time to talk with people about what it is we have in common and what it is we hope to achieve.
The clients that we see, they just know and feel that you are there to help and expect nothing in return.
She knew that she was going to have someone who would listen to her, a team that would never stop trying to get the right outcome for her. Michelle was always one that sort of really sticks with me, just because she had a wonderful sort of approach to life at times. She was a free spirit, and yeah, we just really enjoyed working with her.
People with a living history coming into the clinic room, that's of interest. It's a privilege to know about that, and it gives an insight, and a bit more of an insight when I'm visiting or seeing other people, to know a little bit more about other people's experiences.
Sometimes it's quite hard to stay detached. It's incredibly fulfilling to be able to share some of my own experiences and then to hear the other person say, hey, I tried that, that really worked for me.
I guess growing up many years back in the remote communities, we had community health sisters that came out to us, and that really impacted on me.
Our services are very focused on place. We evolve in public housing, we evolve in particular suburbs, we evolve on the streets where homeless people are. So for us, the idea that we're there to serve a community is as part of our reason for being. It's not just a form of service delivery, it's actually a premise that communities need services close to where they are, but also that communities will tell us what services they require.
Being embedded in the local community, people understand we're with them. What happens in their community affects us as well.
Is difficult is something that we need to explore, and that we need to reach out to the community in a way that people can know about us and that they can feel comfortable.
Everybody's got a story here, and I think just helping each and every one of them is rewarding, because you know you are making that difference.
It's grassroots. You're with the people, you go out to them, and that's how it's so good to work for.
From the minute somebody rings us up or walks in the door, we seek to recognise them where they are and connect with them. And because of the populations we choose to serve, that sometimes takes a while. But more generally, I think we choose to be connected with other parts of our communities, whether that's the library or the hospital or the government or another GP practice down the road. We make an active decision to mix it up and be with others, and I think that the benefit of that, of course, is that we're getting access to a whole range of different ways of doing things all the time. So we're not narrowly defined in the health world. We choose to operate as a health service, but in a much bigger world.
We found that our physiotherapists have been seeing a lot of people with chronic lower back pain. We're in the process now of setting up a group to better service those clients with lower back pain. We're going to be working with Royal Melbourne Hospital, we're going to be educating our staff, we're going to be upskilling staff. So the staff are engaged, it's something the community needs, it's community health in a nutshell.
Sometimes people are disconnected because they don't feel that they belong. We know that there are people who feel very unwilling to come out because then they don't feel that there's a space for them. They feel that maybe their language skills is not enough. They have all the traumatic experiences from back home, and so then it's our role to come and then to invite them.
Our consumers are, by definition, courageous people. It's courageous to live with a mental health issue. It's courageous to be homeless. It's courageous to be a refugee. And I think that our staff try to honour that in their own work. You know, I think that our staff try to match that courage with a quality and level of, you know, a lot of the work that we do other people won't do. And sometimes they won't do it because they don't think it's safe, because they don't think it's got, you know, the sort of financial security or viability that they might get elsewhere. I think the evidence is our people have made a decision that they want to contribute their skills in places that are often, we'll ask more of them. You know, it's true. Our service settings, our service models, our public profile ask people to do things that are not necessarily for the faint-hearted. So yeah, courage is a big part of what we look for when you join this team.
Myself in situations before that have probably been unsafe, but because of the relationship that I've been able to develop with people, that creates sort of a protective factor. And people care about you as well.
When we meet with the men and women together, that it will give me the feeling, this is a family issue. Those people, they will stand for themselves. The community, I feel they are strong to stand and to eliminate the stigma.
I think that one of the major reasons that we have such good quality services is because we do co-design them with people who use them. We have a history of doing that. It's a philosophical commitment we have, but I think it produces a level of quality and of innovation. I say and I believe that our services are as good as they are because consumers are involved in creating them. It's not an add-on for us.
Co-design is about letting our consumers know that they really are in control of their journey, it's their recovery, and that we're prepared to listen to what they value and what they find important and come up with some shared strategies and some goals that really meet what they think support looks like.
Really can't do anything other than a holistic approach. That's just how it's been. You know, we're part of community, it's communal, and you know, that's our culture.
Being able to really have honest conversations with them about why we think this change is good and going to support them in their recovery. You know, they're difficult conversations to have at times.
I think the people who work in community health just genuinely care. If I as a podiatrist need to have a chat to a client about something not related to feet whatsoever, but I can tell that they need just to have a chat about how things are going at home or how they're interacting or their relationship is with their family, I can do that. My manager supports me to do that, and I know that even though I'm a podiatrist, I can have that conversation and help someone.
I think you can't help to be moved sometimes. Many of the typical patients who come to community health service need a time and deserve the time and need a little bit more looking into and listening to than usual, and that's what's expected, not just what's extraordinary.
Welcome to cohealth.